Hello, I'm Dr. Rafi Romano. I am very honored and pleased to present you the 7th movie from the series I've made on the jaw bracket by Adenta Company. Now, this lecture on biomechanics will discuss, of course, not only the specific jaw bracket, but pay attention when we discuss on biomechanics, there is a big difference between big brackets to small brackets. And the difference is in so many parts, in the interbracket distance, in the size of the moments we get, in the how close you are to center of rotation of the tooth, and how easy you get designed and desired movements. So pay attention when we talk about biomechanics to remember how the jaw bracket looks. If you forgot, go back, see the overview on the jaw bracket, and come back to this lecture. The learning objective in this lecture is to learn, first of all, what is moment of force, what the difference between labial and lingual. The second will be tips and tricks to overcome mechanical problems, some of them created by the lingual technique, some of them created by the fact that we have crowding or certain things in the malocclusion. And the third will be an Anchorage principle, the Anchorage principles for lingual orthodontics. Is it the same like buccal? Is it different? We will discuss it in details. First, we should discuss moment of forces. What is moment of forces? Moment of forces is actually the only thing that moves teeth. Bracket do not move teeth. Wire do not move teeth. The only thing that moves teeth is moment that is created by the wire. And the moment is influenced by the force and the distance. The distance is the distance of the wire. The distance is the distance between the brackets. So since we know that today in orthodontics we want to minimize forces, we must make sure that the distance is big enough when we want to create moments. Now, not always we want moments. In cases when the teeth need to be anchored, not to move, we want the moment to be minimal. We want the moment even to be zero. In such cases, we may choose broader bracket. We may take a broader type of the jaw bracket, like the upper anteriors, and put them in the lower anteriors, so we get a broader bracket and a less interbracket space. Put it in mind when you choose your brackets, because depends what we want to gain. You want to gain a big moment, you want a big distance. You want small moment, you want small distance. Now, the center of rotation of the tooth is influenced by many factors, like how many roots this tooth has, how you ligate few teeth together, what is the level of the bone. This virtual point is shifting up and down, depends on the research and depends on the case. In general, let's, for the sake of the discussion, imagine that it is located somewhere in the middle of the root. Now, as you can see here, comparing the buccal to lingual bracket, you can see that in a horizontal type of movement, we get difference in the retroclination moment, which is very dramatic, sometimes double from buccal to lingual. What does it mean? What is the clinical implication? When you apply a retroclination force, like in spaces or proclined teeth, you think that you can use a round wire because the teeth are proclined. Just remember, teeth tend to retrocline very fast because the bracket is positioned more behind the center of resistance. So this is why in the jaw bracket we put rectangular slot, and the rectangular slot enable you to contradict to this retroclination tendency. And when we want to retrocline and use rectangular wire in this jaw rectangular slot, you may get a good torque position when the tooth is retroclining. Same goes for vertical forces. In vertical forces, usually when we do alignment, this is what we use to learn and know in buccal orthodontics. You put nickel titanium wire, you send the patient home, and immediately the teeth are proclining and you get a good alignment. In lingual orthodontics, your bracket is more behind, in the same line sometimes like center of resistance, and you put a wire inside and the teeth are not proclining by themselves, meaning that you have to put in the wire some active force if you want to get proclination that will push the wire forward. I recommend you to go back to the wire bending lectures and learn how you can do it, what type of bends you can do in the wire to get this active movement. Now, there is difference between every tooth, and sometimes two laterals on the same patient can be in different size. So one way is to add composite on the back of the bracket, which will equalize between all the teeth so you can put straight wire. This is very nice, but then all the advantages of a minimal small bracket are lost, because then you get a huge bracket which is based from half metal and half composite. So this is why I recommend you to overcome the in and out problems by doing this small wire bending. Again, you can learn the skills of in and out and up and down bends to overcome this difference in the wire bending lectures. Now you can see that the more composite we add, the closer you get to the center of resistance. Not always desired, but this is a feature that you have to understand. So the bigger the bracket, the smaller the moment. The arch perimeter from the inside is 40% from the buccal perimeter. So every interbracket space is minimized, sometimes even to 0. When you rotate teeth, the two buccal brackets are getting apart, but the two lingual brackets are getting more close to each other. So in a crowded case, we may get a situation where the two lingual brackets are almost touching each other. Again, the smaller the bracket, the bigger the distance. So this is why it is very nice to use this jaw small bracket in such cases where you can use a lingual rectangular small bracket and still get interbracket distance. You can see here an example taken from a CD-ROM made by Scuto and Takamoto with Omco company, and that compare the moment we get for rotation in buccal versus lingual orthodontics. Sometimes the distance, as I told you, is almost 0, and then we have to use our skills in order to artificially create space between the bracket, either by bending the wire or by creating a power chain, which I will show you in a minute, in order to correct these rotations. In lingualnews.com, handled by myself and Dr. Geron, a colleague of mine, very famous speaker and lecturer all over the world, we have designed this website, lingualnews.com. There is a nice article showing all tips and tricks to do rotations, especially in cases where the brackets are so close to each other that we don't have enough space to create the moment. You can sometimes fix one section and then create power chain to rotate a tooth. We can have a power chain that goes around the buccal area coming back to the tooth. We can put a transparent buccal button and from the button tie a power chain to rotate a tooth. we can sometimes bypass a tooth. When you have two rotated teeth, you can bypass one of them, not ligate it, go to the second one, correct the rotation, and only then add the second one. All this is described very nicely in lingualnews.com, but you have here some examples that you can look, learn, and copy. This is another example taken from this beautiful CD-ROM, showing the side effects we have when we try to ligate all the teeth together. You can see here a blocked out cannon that was ligated in one arch to all the teeth. What happens? When the cuspid went down, the roots of the adjacent teeth went apart. This is because of the side effect of the wire that was bended while we ligate all the teeth. The more preferred way is to push the tooth freely to the arch wire, and only when the tooth reaches the arch wire we can ligate it into the bracket. Now, you should understand the features and the wires we are using. When you use stainless steel, if stainless steel is 1, the CNA beta titanium is around 40% in stiffness, meaning that we can get a more delicate force. Remember that when you have short interbracket distance, the wire becomes stiffer. This is why in most of the cases, I start and finish my cases with only 2 types of wire, the nickel titanium and the CNA beta titanium. I hardly use the stainless steel except if I have to close spaces on rectangular stainless steel wire, which has less friction than beta titanium wires. Now, the nickel titanium has around 25% of the stainless steel, and the heat activated nickel titanium, which is the shape memory wire that Adenta has only 10% in force than the stainless steel. So we can use a very, very nice gentle force in the heat activated nickel titanium. You should remember that there is freedom because we do not fill the slot. We have an 18 slot and we use only 16 by 16 wires or 16 by 22 or even 18 by 25, but we have freedom. And this is why when you have tendency for retroclination, it is better if you have a torque in the bracket in order to overcome. The joy bracket has 60% torque in the anterior brackets, which help you to overcome this retroclination movement. You do not get the expression of all this torque if you do not fill the slot completely, but you get at least a nice control of the torque with this rectangular slot. Now, if we use torque in the wire or in the bracket, we add some torque, we get some other side effects. Some of them are desired, some of them are not. When you add the torque, all the wire behind the tooth where you added the torque goes up because you put the torqued wire into the slot, so the wire goes up. This up tendency will create some intrusion in the molar area, will create also extrusion in the front, which will help you to close open bite cases, for example, and will help you also to tilt the occlusal plane. So adding torque is one of the tools we do in order to change the tilting of the upper maxilla and to close open bite cases. This is explained in details in all Mulligan articles, Common Sense Mechanics, which I highly recommend you to read. Here you can see another effect of biomechanics that is, can be seen in space closure. Here you can see that we try to close spaces, which can be from extraction or from spaces that this patient had between the teeth. And what happened is that because the wire was not stiff enough, the wire bends and we get some tilting of the molar, which create extrusion in the molar, extrusion in the central, and intrusion in the premolar area. This is called bowing effect. This is very, very common in very complicated case when we try to change the whole occlusion and doing some extraction and vertical movements. Now, in order to avoid it, one of the tools is to use stiff wires, to use short elastic chains, not big elastic chains. This is, by the way, true for every case. Try not to do a long power chain. Instead, do some metal ligature to fix the teeth that has no spaces and use only small power chains in order to create force only on small segments. Small distance, less moments. Now, anchorage. Anchorage in lingual is very delicate. We have small brackets. We go back of the teeth. What happened to the anchorage? Does it get better or does it get worse? This is a nice article published by my colleague Dr. Geron from Tel Aviv University on anchorage with minimal appliance. Now, there are 6 keys to improve your anchorage in lingual orthodontics. First, to have slightly added torque, which the joy bracket has, in order to overcome the tendency for the teeth to retrocline. The second will be to rotate a little bit the molars. When we tilt the molar bracket, we create like a tip back on the molar and we add more anchorage. Since we do most of our bonding indirectly, this is very easy to be done. The second option is to use bidimensional system. Bidimensional system is not affected in the joy bracket, which is all 18 slot, but we can use a combination of joy bracket in the front, which is 18 slot, and some other bracket with slot of 22, where we have a good sliding. In that way, if you use rectangular wire in this 18 slot, you have a good control in the back, 18 square wire, you have good control in the front, and 22 slot, you have a good sliding in the back. And in that way, you add more anchorage to the system. We can do the same in a different wires, which has also bidimensional sizes. And if you use this system, you get early torque control in the beginning of the treatment, and in that way you lose less and less anchorage. Now, the third key is to get good occlusion in the back. As you saw in the previous case presentation, I looked all the time that I have good occlusion. Now, if you have good occlusion in the back, you have very good anchorage from these molars. Now, if because of the bracket you have opened the bite here, put some stops, some composite stops on the molar in order to have this anchorage either on one molar or on 2 molars when you retract the teeth. The fourth key is to have a very light orthodontic force, not a big force that will bend the wire. And then to do small elastic chain, as we said, and not a big side-by-side elastic chain. And we put also elastics, intermaxillary elastics, in order to control the arches during the treatment in order not to lose control and lose anchorage. And we add to the system the second molar. We bond in lingual orthodontics when you need a lot of anchorage. We always bond the second molar, the 7th, in order to get a good anchorage to the system. And the last point is to do some reverse curve in the wire. This bend in the wire will actually create an active anchor force to the system. If you want to learn again how to do it, go back to the lecture of wire bending and look how we make this bend in the wire. In summary, bending is a procedure we have to do in all orthodontics. Even if you do a straight wire concept, at the end of the treatment, you will need to do this up and down, in and out, and right and left bend to do the finishing. In summary, first of all, analyze every movement you need in the case. See what movement you need, and according to it, plan your moments. Decide how you want to solve the case. This is very important for planning the moment and the forces. Do you plan stripping? Do you plan proclination? Do you plan distalization or extraction? And if teeth moved into a wrong direction, stop immediately the force. Don't try to add force on force on force on force, because then you lose control. Try to stop the force completely, analyze your problems, and go back step by step, going from stage to stage, back to a safe position. Bye-bye.